What is up, guys? Welcome back to Patho and Chill. If you are watching this video, then you probably watched the part 1 of the cancer video, which should be linked here if I can get it to work, or if not, it'll be in the description. So make sure you go check that one out first. Without further ado, let's get started. So now, let's say you find a bump in your body, or you go to the doctor and say that they have found a tumor. Does that mean that you have cancer?
No!
The answer is no, not necessarily. So this whole time we have been talking about what is known as a neoplasm, right? And that is the unregulated excessive proliferation of cells. Okay, so now that I introduced the word neoplasm, let's talk about some characteristics of a neoplasm. Basically, these cells that are neoplastic, they will not listen to any types of cell signalings. They're independent of them. They grow as they wish. On top of that, they also don't listen to any cells telling them to stop growing. So there's, your immune system can come and tell these cells that they are unregularly proliferating, and so they're telling them to stop doing that, and they basically don't care, right? They do not care. They do as they wish. On top of that, these cells are known for altering their metabolism. So instead of generating ATP and saving it for future processes, all they're using their ATP for is duplicating all their organelles. Remember that G1 phase, the G1 part of the cell cycle. They just care about replicating their organelles, replicating their DNA to continue proliferating, continue dividing, and continuing on to grow as a tumor, essentially. Remember, a tumor is not necessarily a cancer. It's just an unregulated proliferation of a cell. So now that we've discussed about neoplasms, we can start to differentiate between a benign neoplasm and a malignant neoplasm. So in a benign neoplasm, this is known for being basically innocent. It is well differentiated. All the cells in a benign neoplasm normally tend to act just like the regular version of that cell in terms of whatever their function is, right? So they look just like the cell and they function just like the cell would. A benign neoplasm is also known for being localized, right? So it doesn't spread out to other places. Wherever it occurs, it stays in that location, which makes it easier for surgery in terms of taking it out. These benign neoplasms, they're localized, and they normally have a capsule, a fibrous connective tissue capsule that bundles them up. It keeps them from going crazy, essentially. And so on top of that, they normally have I keep doing this because they normally have a spherical shape, and they are slow growing. On the other hand, you have the malignant type of a neoplasm, and as I just alluded, the benign are slow growing. The malignant are usually a lot faster. They may also grow slowly. Some types of cancers do grow slowly, but a lot of them grow fast. And so, as you probably already know by now by the word, malignant neoplasm is actually cancer. At that point, you do have cancer. The most defining characteristic of a malignant neoplasm is its ability to invade other tissues and essentially start destroying them, right? And then after that, they're able to move on to other locations in the body. So I'm sure you've heard this word before. It's called metastasis, right? They're able to metastasize throughout the body, and that is via your lymphatics, your blood vessels, so hematogenous, or through body cavities, such as like lung cancers, colon cancers, etc. These type of malignant neoplasms are often very hard to surgically treat because they've moved on to other parts of the body, or if they're still localized, they may be growing through very difficult patterns that make it very hard to surgically take out. And with that being said, once they've metastasized, it increases the chance of death. And normally, if a tumor has already metastasized, meaning it's moved around your body, it's growing very rapidly, the chances of death are pretty increased. So now, how does the diagnosis work? You normally go to a clinic, and the doctor will tell you that there's a tumor. And before saying whether it's benign or malignant, it has to go through a series of staging and grading to basically determine its clinical aggressiveness. So the staging is probably the most important part of the two, in which the actual physician does, and that is seeing basically the size of the tumor, the amount of lymph node involvement, And finally, the extent of distant metastasis, right? So it's called the TNM system, and it basically lets you know what your survival chances are. On the other hand, you also have grading, which is normally done by a pathologist, in which you take a cytologic smear, you send it over to them, that's basically sending them the cells, and they get to look at them and determine what is up with these cells. So then if you are diagnosed with cancer, how can it be treated? Well, there's essentially three ways: either surgical, radiation, or chemotherapy. So surgical is normally done it can be done also on a benign neoplasm, right? It doesn't have to be cancer, but surgical is basically done whenever it's fairly localized, right? It has not spread out, has not metastasized very much. It's often done as a debulking process before going into more serious treatment, such as radiation and chemotherapy, so to try to minimize the volume of this growth as much as possible. From there on, you can go into what is known as radiation. And so radiation is normally, it can be in two ways. It can be an external radiation, or sometimes they can implant little devices that will shoot out beams of radiation internally at given periods of time. Radiation can also be done as a debulking prior to chemotherapy, so it can be done before or even after your chemotherapy treatment. Which leads us to the third one, chemotherapy. Chemotherapy is essentially a combination of multiple drugs that will act on the different pathways that a cancer cell may have to essentially destroy it. It is important to know that chemotherapy often won't be able to cure the actual cancer. Rather, it just extends your lifetime by minimizing it and stopping its progression. There are other forms of drugs that work on inhibiting the external factors of the cancer cell rather than the cancer cell itself. Cancer cells often tend to increase the blood vessels coming to it to gain more nutrients. This is known as angiogenesis. So many drugs tend to work on that. So now that we've basically gone through all these characteristics of cancer, I do want to finish off by saying that prevention is very important, right? Knowing your family history, knowing if you're more predisposed to getting cancer, right? And that is by doing frequent screenings. If you know you're predisposed, do frequent screenings. Even if you're not, it's probably a very good idea to do frequent screenings. Trying to minimize these environmental factors, right? That is why it's very important to quit smoking, not consuming as much alcohol, and these various other carcinogens. So minimize the environmental factors to try to decrease your chances of essentially getting cancer. So with that being said, that is all I have for you guys. Please make sure you like, subscribe to the account, and I will see you guys later. Peace out.